Why is nutrition so personal? Why do we need personalized nutrition? Well, if you listen to what I said about the value of genetics, each one of us responds differently to the food we eat, our environment, our exercise, lifestyle, trauma, and stress. And this is in our genes. So every person will be different, and being able to understand that about the individual enables us to create the most personalized interventions. I often get asked, what is the difference between genetics and epigenetics? We think about genetics, it's our DNA code, it's our blueprint, it's all those letters that make up our DNA sequence. And it defines who we are and how we respond to the world around us. Epigenetics is it's above genetics. It's everything that isn't the code. And in epigenetics, what we're interested is how do our genes express themselves? How do they switch on and how do they switch off? The value of genetic testing is not that it provides an absolute answer. The value of genetic testing is as a screening tool that allows us to know what we don't know, to know where to start, to know where to focus our attention, to choose the best functional test, to target our supplementation. So it reduces our trial and error when we're working with patients. One of the best questions you can ask of any genetic testing company is how do they decide which SNPs to include in their genetic test? And there are two core principles: scientific validity and clinical utility. And by this we mean scientific validity, is the science good enough? And clinical utility is, will this actually help you make a better or different clinical decision if you have this genetic information than if you don't have the information? Some say it's too early to be working with genetic testing, but I will tell you that I've been doing this for 23 years, built and sold my first genetic test in the year 2000. There is so much we know. Yes, there is a lot we don't know. But if we focus on that scientific validity and clinical utility, we make sure that we're using the best possible science to personalize our interventions, but not using the science that hasn't yet reached the limit of clinical utility and scientific validity. So come to the symposium to learn more.